I'm Amanda Kreider, and I am an assistant professor in the Department of Health Policy and Management at Pitt. So I'm trained as a health economist. I primarily focus on Medicaid and other public health insurance programs like Medicare, as well as aging and long-term care. Some of the most meaningful work that I've done has come out of sort of collaborations with policymakers. So in graduate school, while I was a PhD student, I had the opportunity to work on a project that was focused on Medicaid in New York State. And my co-authors and I had the opportunity to actually meet with the state Medicaid directors and share our findings. And they were really interested in what the implications of our work were for policy and how they might make sure that Medicaid enrollees in New York had good access to specialty care. So that was really cool. I hope to do more of that kind of work in the future. I was in grad school fairly recently. Being a graduate student is really challenging. And so I would say certainly don't be too hard on yourself. You're taking in a lot of new information. And don't be afraid to ask questions. Usually people can be afraid to ask a question that they might think is a stupid question, but usually someone else in the room is having the same thought, and you're helping not only yourself, but other students by asking. So when I first interviewed at Pitt, I think one of the things that really stood out is just how friendly everyone was. I had got such a good vibe from this department. And I've noticed since I started, people will actually stop me in the hallway to welcome me to Pitt. So that's been really amazing. And also, I've been so impressed by the students. I find the students all the students I've met have been really smart, really motivated, really altruistic. They want to make a difference in the world. And so I can't wait to get to know more of them.